Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Causes and Treatment of Obstructive Sleep Apnea, presented by Dr. Jason Van Tassel, Otolaryngologist with Washington Township Medical Foundation. Dr. Van Tassel practices all aspects of otolaryngology and has been working at Washington Hospital Medical Foundation for over 17 years. Please welcome Dr. Van Tassel.
Good afternoon. My name is Dr. Van Tassel. I'm going to be discussing specifically InSpire medical therapy for the treatment of obstructive sleep apnea today. First of all, many of you understand what obstructive sleep apnea is. Many people snore in our population in the United States and worldwide. Sleep apnea is defined as when the airway completely collapses, as shown here on this animation. Sometimes that's positional and only happens when people are on their back. Sometimes it's in all positions. Some people do it when they're even sitting up while they're asleep. And it's caused by a multitude of factors. The principal factor that's being shown here is that the tongue falls back and obstructs the airway. Sometimes it's the palate, sometimes the nose is obstructed and drives it, and sometimes it's the epiglottis. But for simplification, we're just showing the dynamic collapse secondary to tongue-based collapse, which InSpire specifically addresses. Sleep apnea is a very widespread disease in the United States and worldwide. There is a lot of consequences as a result of the condition, from fatigue and diminished productivity at work to the risk of falling asleep at the wheel and having a car accident, annoying your bed partner, and then the specific heart and brain health effects that it can cause. Sleep apnea affects the whole body. There are, in addition to just causing poor sleep, a multitude of effects that can happen, especially in the context of severe obstructive sleep apnea. Daytime sleepiness, mood disturbance are common complaints, loud snoring, especially from the context of bed partners. It puts specific stress on the heart, which over time can lead to hypertension and coronary artery disease. It can lead to cardiac arrhythmias, such as atrial fibrillation, and in its most severe cases can lead to congestive heart failure and even sudden death. There are considerable health costs and medical costs that are attributable to obstructive sleep apnea. Yet this disease, though it's central to so many health conditions amongst our population, is underreported and undertreated. In addition to all of the things that I spoke about before, it can also cause type 2 diabetes. It can lead to obesity and create somewhat of a doom loop in regards to the worsening of sleep apnea and the worsening of the obesity and the other consequences, because what ends up happening is when you have a bad night's sleep, your body releases hormones that are stress hormones, but those stress hormones cause your body to store fat, which causes additional stress on the body and over time worsens obesity, worsens hypertension, and worsens diabetes. And so it's really important to try to get a handle of it, or a handle on it, in order to get this treated and help it and allow patients to have a much healthier and longer lifespan and a longer health span. The prevalence of obstructive sleep apnea in the United States is about 18 million people that had moderate to severe obstructive sleep apnea. In the total population, we estimate that between 5 and 15% of people have significant apnea that needs to be treated. This goes up every year as our population ages and our population becomes more obese. The effects of untreated obstructive sleep apnea are that it severely affects mortality. In patients that have mild sleep apnea, as shown in the graph on the right with an AHI, which is the definition of obstructive sleep apnea under 5, there is a slight decrease in survival over long periods of time. But as you see in the graph, The right down below, in patients that have an apnea-hypopnea index over 30, the survival rate is much lower. In fact, you have a 5 times higher risk of early death if you have untreated severe obstructive sleep apnea than the general population. Cardiology and sleep apnea are very closely connected. There was a study that was done in the Journal of Clinical Medicine in 2020 that looked at the prevalence of obstructive sleep apnea in cardiac patients, and it was found to be present in 48% of patients. Atrial fibrillation is the most common arrhythmia, and it has an incidence that is 88% higher in patients with obstructive sleep apnea than those without. The primary complications of atrial fibrillation can include heart failure, stroke, and heart attack, and even death. So it's important, especially in the context of having atrial fibrillation, to treat the sleep apnea, as it will cause less heart strain. And it's probably the sleep apnea in the first place that caused the heart strain that resulted in the atrial fibrillation. So CPAP is the front line and gold standard treatment for obstructive sleep apnea. It has great results when it's used regularly, but it does require a machine and a mask and some maintenance to keep the tubing clean. And for some patients, it's just not an acceptable solution. Some people can't tolerate it. Some people move around a lot in bed and the mask tears off. Some patients are unable to tolerate it for a variety of reasons. Some patients' anatomy doesn't allow them to tolerate the CPAP. There are more sophisticated options than CPAP, which include something called BiPAP, which is a bi-level CPAP, but still patients have difficulty tolerating the constant pressure in their nose and face all night. And so some patients seek alternative treatments. If you look at the amount of patients that are compliant with CPAP over the long term, it's only about 50%. So alternative treatments include an oral appliance that is made by a dentist or other surgery that alters the anatomy. The dental appliances are usually used in patients that have obvious dental abnormalities or large tongues and have somewhat mild to moderate sleep apnea. But their limitation is that when you transmute the jaw forward too far, it starts to cause problems in the TMJ. And so it takes some time to kind of get the oral appliances adjusted right, and they don't work in all patients. There are a variety of surgeries that address the jaw, the tongue, and the throat, and even the nose to create a larger airway. And they have applications in specific instances where, for instance, the tonsils are very large, or the nose is very obstructed, or if there is a specific collapse of the airway in a location such as the epiglottis in the absence of others that can help to alleviate it. And so in patients that have these specific conditions, those surgeries are indicated to fix it, and in addition, sometimes patients will also need to undergo several procedures in order to get the sleep apnea improved. So Inspire therapy is a medical device that gets implanted, and it is a hypoglossal nerve stimulator which is attached to some of the branches of the distal hypoglossal nerve. There is a lead that goes down and communicates with the computer box, which gets implanted in the chest. And this also contains a sense lead that will sense when you take a breath. It comes with a remote control and an app to help to monitor your quality of sleep. The stimulator cuff stimulates the tongue to protrude and helps to open up the airway and bypass the obstruction. It's inserted through 2 small incisions, one that is in the neck and then one that is down in the chest. The typical duration of battery life is about 11 years, but it can go beyond that. I have a patient that's in my practice that's had his for 12 years, and the battery was just recently tested and it's still working just fine. Originally, when the Inspire first came out, you couldn't get an MRI, but now they've changed the design and re-engineered it, and you can go ahead and have an MRI without any significant problems with the device. This is how it works. Patients have a remote control which they activate and turn it on. There's a delay so that you can get off to sleep, and after about 15 or 20 minutes, whatever the time that you set for how long you want to get to sleep, the device will turn on, and then it will stimulate the tongue to protrude just on one side, just enough to move the tongue out of the way and allow the obstruction to be alleviated. And it's not something that is going to cause a significant amount of arousal. The cuff is around the nerve, and so it doesn't cause you to wake up. You don't feel it unless you are trying to talk while you're breathing, because then it will distort your ability to speak. And then you just turn it off when you are done. So in terms of the efficacy of the Inspire medical implant, the patient satisfaction is very high. It's about 94%. And what's important to note is that there's good adherence to the treatment. As I said previously, that the compliance rate for CPAP is only about 50%. Most patients are still using it at their final follow-up visit. The results of the Inspire medical implant demonstrate a 79% reduction in the apnea-hypopnea index. The study that this comes from was the original clinical trial that had an average apnea-hypopnea index of 29.3 before the Inspire and an apnea-hypopnea index of 6.2 after the Inspire implant. There is growing adoption as a result of sustained clinical results. There are over 100 peer-reviewed publications and 5-year follow-up data. Most insurances are now covering it, although there are some limitations. Medicare covers it across the United States, many VA military hospitals, and a number of private insurance companies will cover it. So the question is the Inspire right for you? There is indications for moderate to severe obstructive sleep apnea if you're unable to get consistent benefit from CPAP and you're not significantly overweight. There is a limit with regards to the body mass index that you have to be below, and I'll get into that in just a minute. When we intake patients for this, for sleep apnea, and for patients that are being considered for the Inspire medical implant, we typically will do an examination in the office. If they haven't had a previous sleep study, we'll send them for the sleep study. Usually we'll do a CPAP trial, and then if they can't tolerate the CPAP, have them back. Most of our patients that are referred to us for surgery have not been able to tolerate CPAP, which is the reason for the referral. The next step from that initial visit is to do what's called a sleep endoscopy, and the sleep endoscopy's purpose is to assess the pattern of collapse, and we look for certain things with regards to how the obstructed airway collapses and the way that it collapses to see if patients are a candidate for the Inspire. There is an ambassador program that exists for Inspire through inspiresleep.com that can connect patients that are thinking about doing the Inspire medical implant with patients that have had it, and can help patients understand some of the ins and outs and get better understanding of what life is like with the implant. And then for more information, you can contact my office at 510-248-1590 or go to our website, www.mywhitmith.com. This is an example of a patient who had an Inspire implant in July of 2018. She was unable to tolerate CPAP and BiPAP, and then she had nasal turbinate reduction. Sometimes we do nasal turbinate reduction because they can't tolerate CPAP secondary to nasal obstruction. So we try to alleviate the nasal obstruction, and then if that doesn't work, then surgery is attempted. And so she was struggling with some mild cognitive impairment, and then she was relying on stimulants to stay awake. She had the Inspire medical implant, and then post-implant she's feeling better. Her memory's improved. Her post-implant apnea-hypopnea index is now in the normal range of 4 versus what it was at 20.6 pre-implantation. So this is just an example of a patient who's very satisfied with the treatment. There's an app that goes with the device that shows you how the Inspire works, and you can watch videos with the most common questions and connect with people who have the Inspire. And that's it. Thank you very much.
Thank you, doctor. We do have a couple of questions. The first one is, I have symptoms of sleep apnea, but I live alone. How can I find out if I snore?
Well, the easy thing to do is to record it if you happen to have a smartphone. If you don't have a smartphone, you can use a digital recorder, some kind of a recording device to just record while you sleep. There are a number of sleep apps that you can download from the App Store if you happen to have an iPhone, or even whatever the other companies are that make phones, Samsung. And it'll record your sleep, and it'll tell you if you snore, how much, how loud, and sort of give you an idea. And then from there, you can talk to your primary care provider, and they can either order a sleep study for you or come into our office and we can order it for you.
Okay, thank you. And is the Inspire covered by insurance?
It's covered by most insurances. There are some limitations based on body mass index. So body mass index is a calculation that's made based on your weight and height, and you can't be too overweight to do it. Originally there was a cutoff of 32. The FDA has broadened it, and some insurance companies have loosened their restrictions up to almost a BMI of about 40.
Okay, thank you. This does conclude our program. Thank you, Dr. Van Tassel, for joining us today, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.